Hey guys, today we'll be discussing everything you need to know about PRP treatment. You guys might have already watched Dr. Linkov's PRP video, but if you haven't, make sure you check it out at the end of this video. Before getting started, I do want to do a quick recap about PRP, also known as Platelet-Rich Plasma. These platelets have a high concentration of growth factors that are used for the treatment of hair loss. Many may ask, what can I do to prepare for my PRP treatment? One of the most important things is to make sure that you stop certain medications because they can cause you to bleed more. These medications are aspirin and non-steroidal medications such as ibuprofen, Motrin, Advil, Nuprin, Aleve, and Celebrex. Some vitamins that you may also want to avoid are fish oil, St. John's wort, and high doses of vitamin E for at least 7 days, and this is to prevent some bleeding. Patients that take blood thinners like Coumadin or Plavix should stop their use 7 to 10 days before and for 2 days after the treatment. But before you do this, make sure that you speak to your prescribing provider as these medications are medically necessary. Medical history is very important. Make sure that you let your healthcare provider know if there are any conditions such as abnormal platelet functions, active systemic infections, low platelet counts, severe anemia, pregnancy, and even hypofibronagemia, as PRP is not recommended for these conditions. The day before and the day of your treatment, it is important that you have full meals and drink plenty of fluids, as this is going to allow us to have a successful blood draw. Don't forget to wash your hair, as it is important to have a clean scalp for optimal treatment results. So some patients may ask, or you may be asking yourself, what happens during the actual procedure? We bring you into the room, we talk about your history a little bit and what's happened with your hair loss in the last few years, the last few months, etc. And once we have that history, we then start to get everything ready for your PRP. The PRP will get set up and your blood will get drawn. While your blood is being processed in the centrifuge, then the medical provider, myself, or one of my lovely coworkers will get your scalp ready. And once this scalp is ready and your PRP is set up, we will then inject it into the area. But before we do those injections, we like to do anesthesia, which in turn is a little bit uncomfortable, but it will make the process much more comfortable and allow you to get through it better. Once we have completed the injections of your PRP, we activate it with microneedling. Once that is complete, we then cleanse the scalp. Before you go home, we set you up with your appointment for your next treatment. Then you go home. What happens at home? What things should you look for after your treatment? Once the treatment is completed, you may experience soreness, swelling, tenderness. These are all normal symptoms post-PRP treatment. You may have slight discomfort to the site of the blood draw and to the areas injected with the PRP. This can be fixed by just taking Tylenol over the counter. You may also use some cold compresses to help with some of the swelling and soreness that may happen. If you wanted to wash your hair post-procedure and cleanse your scalp, which is totally normal, you can do so 6 hours after the treatment. Remember, swelling can happen if you lay flat, so we recommend that you sleep at a 35-degree angle the first night to help decrease some of that swelling. And don't go too crazy and go have a full session at the gym. Take it easy, rest if you can, and recover from your PRP treatment. Lastly, you may be wondering, how many treatments should I have? It is recommended that you complete 3 consecutive treatments, 3 to 4 weeks apart, to obtain stability of the hair loss. Once we have completed these 3 sessions and you have stability, we can then do maintenance treatments every 3 to 4 months or 4 times a year. If something comes up after your treatment has been completed and you are home and have questions, concerns, please don't hesitate to contact us or your healthcare provider and ask those questions, as that is very important. Hope you enjoyed this video, and check out Dr. Linkov's PRP video that is much more detailed.